8N, Ministry of Foreign Affairs, Mr. Alex Yam.
Chairman, I beg to move that the total sum to be allocated for head N of the estimates be reduced by $100. COVID-19 has brought about tensions in foreign relations amongst various nations. Borders were hurriedly closed as governments attempted to stem the spread of the virus. And added to this was the tension arising from even the transnational supply of medical equipment. Nationalism was rearing its ugly face, and multilateralism was elbowed aside. In closing the 75th session of the UN General Assembly last September, Assembly President Volkan Bokcia noted that the pandemic has been a test, demonstrating that multilateral cooperation is the key to overcoming global challenges, and he stressed the need for collective action to tackle common threats and vaccine multilateralism to combat the coronavirus. In this pandemic, the absence of cooperation is somewhat puzzling because global public health generally requires cooperation to control its spread and to minimize the damage to the global economy. Dr. Joshua Busby of the Robert S. Strauss Center for International Security and Law pointed out that in the past, if we looked at various diseases and epidemics, the US and the Soviet Union found it within their interests to cooperate and even outdo each other, such as on the eradication of smallpox in the midst of the Cold War. The dissonance amongst leading nations amidst this pandemic prompted even Pope Francis last October to issue an encyclical to lament the poor cooperation amongst countries and to warn that the forces of myopic, extremist, resentful, and aggressive nationalism are on the rise. I quote from that encyclical: "Aside from the different ways that various countries responded to the crisis, their inability to work together has become quite evident. For all our hyper-connectivity, we are witnessing a fragmentation that made it more difficult to resolve problems that affect all of us." With the then US administration vigorously advancing its America First policy, a mixture of nationalism, unilateralism, and xenophobia, and its rivalry with China, the world was left perhaps with a leadership vacuum. The resultant fallout was a relative decline in multilateralism and a weaponization of global interdependence. This is fast becoming a new normal. I recall that in the early days of the crisis, the great uncertainty that permeated as borders started closing and the then unknown virus was spreading rapidly. I also remember a many frantic resident contacting to ask for advice as they or their family members tried to leave parts of the world, such as China, to return home for safety. Our MFA consular officers were tested up to the hilt to mobilize resources to bring Singaporeans overseas home to their families during this crisis. A debt of gratitude to all those who worked so tirelessly then and now to bring them home. Can the Minister therefore speak on our efforts to bring Singaporeans home over the course of the pandemic as borders close? These borders closures also disrupted much of our supply chain. How did the Ministry do its part to ensure that our supply chain continuously connected us to the world? As we begin our vaccination campaign in earnest, it's worthwhile stating that Singapore is an early supporter of COVAX, the COVID-19 Vaccination Global Access Initiative. How is Singapore playing its role as a responsible global partner and neighbor in this regard? Chairman, I beg to move.